Do you have an IUD? And have you been wondering what to do if your IUD falls out? How likely is it to fall out anyway? And what are your pregnancy chances if this happens? Well, I've got the answer to these questions and a lot more about IUDs falling out in this video. Hello, I'm Dr. Sylvia, a general practitioner and health educator with AskAwayHealth. I share health information videos to help you learn about your body and live well. If that's the kind of information you're interested in, make sure you subscribe to my channel and please click the notification bell so that you know every time we publish new videos once a week. If you have an IUD or intrauterine device, you have one of the most effective forms of modern birth controls. Apart from working very effectively, there's also no hassle, for example, remembering to take a pill or to put a condom or diaphragm on before sexual intercourse, or having to come in to have injections every 3 months and so on. With an IUD, all you need is a day when the device is fitted into your womb, and soon after that you have 5 to 10 years of protection depending on the type of IUD that you've chosen. Yes, there are two types of IUDs, those with copper, also known as copper coil or copper containing IUD, and those without copper, which contain the hormone progesterone. The IUDs that have progesterone in them are also known as intrauterine system or IUS. Can an IUD fall out? Your IUD is fitted right within your womb and most of the time will remain in place until your doctor or nurse removes it. But in a small number of cases, IUDs have been known to fall out. We don't know exactly what makes an IUD fall out, but we do know that certain things make it more likely to happen. And what might make your IUD fall out may be quite different from what affects another person. How often does the IUD fall out? 1. Your IUD might be more likely to fall out if you're between the ages of 15 and 19 years. Studies show that older ladies are more likely to keep their IUDs in place. We're not sure why this is the case, and studies also tell us that it doesn't really matter whether you've been pregnant and had children before having the IUD fitted. It's just that the older you are, the less likely the IUD is to fall out. Number 2, a womb with an irregular shape. For example, if someone has fibroids, can make the IUD more likely to fall out. Fibroids are benign growths of the womb. You can learn a lot more about fibroids in my video here. Their presence makes the womb surface to be uneven, and so the IUD may not be able to stay in position, and so it's more likely to fall out. But some women may have a double womb. This is a rare condition but present from birth when the structures that make up the womb during early development do not form together properly. A third reason, and one that is quite common, is that the IUD can fall out if you have very heavy and very painful periods. Dysmenorrhea is a term that's used to describe very painful and heavy periods. If you suffer from this condition, the muscles of your womb cramp very intensely, which can contribute to pushing the IUD out of place. Have you just delivered a baby? Or in some cases, if you've just had a termination or abortion. If you have an IUD fitted very soon after either of these scenarios, the IUD is very likely to fall out. And this is because within the first 1 or 2 weeks of either of these two conditions, the womb is still very sensitive. It's still full of blood, tissue and other post-pregnancy material. Your body will naturally remove this material from the womb, but if you have the IUD in, it may be flushed out at the same time. So the recommendation is to prevent the IUD falling out within 6 months of being put in. Wait at least 3 weeks from having your baby or from the termination before putting the IUD in place. And number 5, it's been observed that the intrauterine system, that is the coil with the progesterone hormone in it, seems to be more likely to fall out than the copper coil. And 6, it is more likely for your IUD to fall out if the person who is fitting it in the first place is not very experienced. Having an IUD fallout is most likely going to happen within the first 3 months. But if it does fall out, what does an IUD falling out feel like? Once you have your IUD in place, the risk it's going to fall out is highest just after your first period. But if it stays in place after this period, then the chances that it's going to fall out is very minimal. And studies tell us that if 100 women have the IUD fitted, only between 2 and 10 of them are likely to lose their coil in the first 12 months. Now, after your IUD fitting, one of the key instructions that you're given is to make sure that you keep a close eye on the strings of the coil. Your IUD comes with a couple of little strings that dangle at the bottom of the device, and checking on them is to be sure that you can still feel the strings within your vagina. Being unable to feel the strings could suggest to you that the IUD has either fallen out or been dislodged or displaced somewhere within your womb. You can check your strings by yourself by inserting 2 clean fingers within your vaginal canal and feeling the strings right at the top of the entrance to the womb. But here are some signs that might suggest that everything is not right when you check to feel for your strings. Number 1, the strings are shorter than usual. Number 2, the strings have an uneven length. Number 3, they may seem out of place. And 4, if you can't even feel the strings in place. Some ladies do not feel the IUD falling out. However, if the IUD is coming out, you may have symptoms. For example, heavy vaginal bleeding, painful cramps from your pelvis or your abdomen, particularly if they're getting worse or do not get better after simple pain relief like paracetamol or ibuprofen. If you have an abnormal vaginal discharge, or if you're feeling unwell or just off things, for example with the fever or other signs of illness. What do you do if your IUD falls out? If you feel or suspect that your IUD has fallen out or is falling out, please speak to your doctor as soon as possible. Make sure you avoid having unprotected sex until you're sure that your device is still in place. You will also need to have a pregnancy test because we don't know for how long the coil has been out of place. Your doctor will need to carry out an internal pelvic examination to find out if the IUD is still in. If the doctor can see the coil and it appears to be displaced, they may be able to remove it in the clinic if they've got the right equipment. If we cannot see the IUD or the strings, you will need to have a pelvic ultrasound scan to locate the device. An IUD that has fallen out or is misplaced means that you are at risk of an unplanned pregnancy. It can also mean a higher risk of a miscarriage or an ectopic pregnancy, which is when the pregnancy is located outside the womb, most commonly within the fallopian tube. Other problems that could happen when your coil goes misplaced or missing include a womb infection or pelvic inflammatory disease PID, which is when there's an infection to the womb and other reproductive structures. In addition, you may experience very heavy blood loss, which could lead to you becoming anemic. Also, while the coil is misplaced or moving around, it could perforate the womb. I hope this video answers all your questions about the IUD falling out. Let me know if it does and if you have any other questions, and please make sure you give the video a like if you found it helpful. Next time we're going to be looking at reasons why your IUD might fail. So make sure you have subscribed to the channel and turned on your notifications by clicking that bell so that you know every time our new videos go live. While you're waiting for me to publish the next video, check out these 2 here, and I'll see you again soon. Thanks for watching.